goat outside.
It's just a goat.
No, it's a fucking goat.
Hold up, take a moment, count like walk, count like walk. All these racks bumming in, they bumming in. Hold up. Count.
From a hormonal standpoint, how does the birth control pill alter the body's natural cycle?
A great question, because to understand how birth control pills work, we should understand first our natural menstrual cycle. So we have an axis in our body. It's axis named hypothalamus, pituitary, and ovaries axis. So GnRH from hypothalamus comes to affect on pituitary gland, and then FSH and LH secrete from that part of hypophyse, and then they go to affect on to have effect on I mean ovaries. So this is a normal cycle, and it lead to develop a follicle, and ovulation happen after that. So in a cycle, estrogen rise in the first half of the cycle, peaking just before ovulation. And after that, progesterone take over in the second half of the cycle. So they prepare the uterus for a normal pregnancy. OCPs contain synthetic estrogen and progestin. They suppress the release of FSH and LH from hypophyse or pituitary gland. And this situation is something like early pregnancy, something like hormones in early pregnancy. So these hormones change can also influence mood, libido, and even emotional sensitivity.
Research suggesting that hormonal birth control might affect who we're attracted to, and that's kind of what we're trying to discuss today. So, have you come across this in clinical practice or heard patients talk about how changes in their preferences or relationships before?
I should say yes, on occasion. Why many people don't associate these changes in their contraceptive method, other may notice them and talk about during follow-up visits. Studies have shown that hormonal contraceptives can influence olfactory perception and emotional processing, and even how facial features are perceived.
We're four guys here. We obviously don't use birth control, but we wanted to dive into research and talk to people who do to better understand how this stuff works and why it matters.
Yeah, I mean, we're not here to speak over anyone's experience. It's just bring attention to something I think more people, especially guys, should know about.
So overall, choosing the right method often involves some trial and error, and a personalized conversation with the patient, between the patient and doctor.
Okay. So, what advice would you give to someone who is thinking about starting an hormonal birth control, but is also trying to navigate dating or looking for a long-term partner in the process?
So my advice would be to make decision with full awareness on both physical and emotional aspects of the methods.